Welcome back. Each January, roughly 1 in 3 Americans resolve to better themselves in some way. But where do you begin? Well, self-assessments for both your mental and physical health are important. Gulf Coast Clinical Research Center may be able to help. Christine Gorgas is the operation manager and joins us once again. Good morning.
Good morning.
We've missed you.
I know.
Welcome back.
Thank you for having me again.
I love that we're talking about, in January, a lot of people looking to kind of better themselves.
Yes.
And mental health is just as important as physical, is it not?
It is. A lot of times resolutions are to stop smoking or I'm going to eat healthier or I'm going to start working out. But you really need to take a step back and look at how you're feeling as well. Are you not able to get over these Christmas blues that you might be having? Is there maybe something wrong with the level of worry that you have, the level of anxiety? And what we can do at Gulf Coast Clinical Research is help give you those tools to be able to walk through your symptoms and really help empower you to know what you're feeling, what's going on, and then possibly present you with some alternatives and some next steps.
Yeah, the key word is assessment. So that's kind of what you're able to help guide people. Because I think when you're feeling that way, whether it's a funk or something more serious, you don't really know kind of what tools would be best to figure out what's going on.
Absolutely. A lot of times people will write it off of I'm not getting enough sleep or something's going on at work, so I'm being stressed. What a lot of our tools do on our website is help you walk through the different symptoms of both depression and anxiety, even pain indications like fibromyalgia. Walk you through the typical symptoms so that you can answer for yourself, is this what I'm feeling and is this causing some kind of impairment in my life? I know we talk a lot when we've done these that it's not only the symptoms, but is this impacting your life? Are you having impairment from your feelings of sadness or your feelings of anxiety, from your pain levels? That's the time to really start seeking treatment. And then, of course, the next step on the website tells you what type of trials that we're doing and maybe what resources out in the community can help you.
Well, and talk about these research trials that you guys use and kind of what the benefit of those and maybe getting involved and how it's able to really help the community as a whole.
Absolutely. A lot of times these are a different avenue for patients. Maybe you have a doctor, but you're not happy with the treatment that you're having. Maybe you don't have insurance and can't get in to see a physician. A clinical research trial may be an option. It's basically a very structured approach at looking at how a medication works with both its efficacy and its safety for a certain indication. Some of our research trials are with medications that have been approved for different indications, but they're looking at, am I effective at another indication? Some of them are what we call experimental drugs, which means the FDA has not yet approved them for the indication that they're seeking. And others are observational trials, like our smoking cessation trial. It basically is just observing what the health changes are a year after a patient stops smoking.
Which is very interesting, and I'd imagine a lot of people want to know what those results are.
Absolutely. There's a lot of different information out that you can see, and we all know the classics, that your blood pressure stabilizes, that you reduce your risk of stroke, of heart disease. You can reduce your risk of different cancers. But this is one of the first global FDA-sanctioned approved trials that are really looking at much more beyond that. So we're actually looking for patients who are interested in quitting. It's not a medical intervention trial. We will provide patients with a smoking counselor. And hey, it's a great way that you actually get paid to quit smoking.
That's awesome. That would be just a motivation in and of itself. Well, and this is interesting, focus of depression symptoms and benefits of quitting smoking.
That is also, they look at both your mental health, they look at both your physical health, so they're looking at really everything across the board. But we always talk about depression this time of year. The holidays can be very hard for people, and with some people that have episodic depression, we usually do see a reoccurrence of their depression symptoms about this time of year. So we really encourage people to go onto the website. Don't wait. If you are having these feelings of sadness that are with you the majority of the day, the majority of the week, if you found that you can't really get back into the swing of things, you've lost interest, you're having those physical symptoms of lack of sleep, changes in your appetite, changes in your concentration, fatigue, don't wait. Go on, do an assessment, and see if there's something that we can help.
And I think that's the hardest thing to know is this just something temporary or is there something more going on? And I know there's a stigma about mental health too, but you can do something about it.
You can.
You know, as we kind of close, what is the take home to really motivate people to call and get the help they need.
We really want you to empower yourself. The best thing that you can do for your mental and physical health is not to be afraid to ask questions and really empower yourself. And that starts with knowledge. And at Gulf Coast, that's our main goal with the community, is to be able to give you those types of tools that you can use, the privacy in your own home to go through assessments. And then if you have questions, we're always willing to listen and to help.
So I know you said there's a website, so maybe that's the first place to do if somebody wants to go ahead and get started today.
Actually, that's the best place to go, first and foremost, is to look at the website, learn a little bit more, take those assessments, but you can always call us as well. All of our counselors are always able just to break down, talk to you about what you've been experiencing, what medications you've currently been taking, and provide you with the different options that we may have available for you.
We hope that we can help, and I know certainly you guys do too, you know, improve somebody's new year, their 2016. So Christine, we love when you're here. Thank you so much. We look forward to having you back.
Thanks again.
Of course, for more info, you can head to our website as well, fox4morningblend.com.
All right, do you know who to call when disaster strikes? Up next, how United Way unites our community when devastation and disaster drops in. And later, rev up your engines. We are cruising on over to the Detroit Auto Show and putting you on the inside track with a glimpse from the showroom floor.